Frequently asked questions about ketamine therapy. Did you know? Some patients with severe depression report relief within just 24 hours after receiving ketamine therapy. This has sparked growing interest among both patients and mental health professionals, especially those treating individuals who haven't responded to conventional options. But what exactly is ketamine therapy? How does it work? And most importantly, could it be the right choice for you or someone you care about? Let's walk through the most frequently asked questions in this comprehensive overview. What is ketamine therapy? Ketamine therapy is an innovative mental health treatment that's being increasingly used for individuals with treatment-resistant depression, PTSD, anxiety, OCD, and chronic pain. Originally developed in the 1960s as a dissociative anesthetic, ketamine was widely used in surgical and battlefield medicine. Decades later, researchers discovered something remarkable. At low doses, ketamine has rapid-acting antidepressant properties, unlike anything seen in traditional antidepressants. Today, ketamine is administered at sub-anesthetic doses in medical settings to support mental wellness. It's considered a breakthrough treatment by many experts, and it may offer hope when other treatments haven't. How does ketamine work? Unlike traditional antidepressants that primarily target serotonin or norepinephrine, ketamine acts on the glutamatergic system, specifically the NMDA receptor. Here's why that's important. Glutamate is the brain's most abundant excitatory neurotransmitter. It plays a critical role in mood, cognition, and the brain's ability to adapt and change, a property known as neuroplasticity. Ketamine is thought to rapidly increase neuroplasticity, allowing the brain to form new connections and pathways. This may help reset patterns associated with depression and trauma, and is why some people experience relief so quickly. Who might benefit? Ketamine therapy is most commonly used when other treatments have failed or haven't worked well enough. It may be appropriate for individuals with major depressive disorder, especially treatment-resistant depression, post-traumatic stress disorder, PTSD, generalized or social anxiety, obsessive-compulsive disorder, OCD. Certain forms of chronic pain, like fibromyalgia or CRPS. However, it's not a first-line treatment, and it's not for everyone. Before starting, a qualified provider should complete a comprehensive mental health and medical evaluation to determine if ketamine is safe and appropriate for you. What should I expect during a session? Ketamine therapy can be administered in different ways. Intramuscular injection, IM, most common outpatient. Nasal spray, compounded or Spravato, FDA approved for depression. Sublingual or oral lozenges, semi-common outpatient. IV infusion, most common and studied. Sessions typically last 45 to 120 minutes, depending on the method.
You'll be in a comfortable, safe setting, supervised the entire time. Patients often describe the experience as feeling deep relaxation, a sense of mental clarity or insight, sometimes a dreamlike or dissociative state. This state can help people reflect on thoughts and feelings in new ways. Many clinics incorporate music, soft lighting, and therapeutic support to enhance the experience. You'll need a ride home afterward, as driving immediately post-treatment isn't safe. Are there side effects? Like all treatments, ketamine has potential side effects, though most are mild and short-lived. Common ones include mild dissociation or a sense of disconnection from reality, dizziness or lightheadedness, increased heart rate or blood pressure, fatigue or nausea, usually short-term. The good news is these effects typically wear off within an hour or two. Your provider will monitor you closely and review all risks beforehand. If you're taking medications or have certain health conditions, those will be discussed during your screening. How many treatments are needed? Most patients begin with a series of 6 sessions over 2 to 3 weeks, often referred to as the induction phase. This helps build the neuroplastic momentum needed for lasting improvement. After that, maintenance treatments are tailored to the individual. Some people continue with booster sessions every few weeks, monthly, or every few months, while others may need them less frequently. Your provider will track your response and adjust your plan based on your goals and how you're feeling over time. Is it safe? Yes, when administered by trained professionals under a licensed physician in a clinical setting, ketamine is considered safe and well tolerated by most patients. It's essential to be under the care of a licensed physician or psychiatric provider who understands both the medical and psychological components of the treatment. However, ketamine is not recommended for people with uncontrolled high blood pressure, active substance use disorder, or a history of certain psychotic disorders unless closely monitored. Also, patients must avoid alcohol and recreational drugs during treatment. It can interfere with the therapeutic process and increase risks. Is ketamine a cure? It's important to be realistic. Ketamine is not a cure for depression or trauma. It's a powerful tool that, for many people, allows them to engage more fully in therapy, re-establish healthy habits, and reclaim their lives. Often, ketamine works best as part of a comprehensive treatment plan that includes talk therapy, lifestyle support, and possibly other medications. Final thoughts. Is ketamine therapy right for you? Ketamine therapy isn't for everyone. But for people with complex mental health challenges who've tried multiple treatments with little success, ketamine may offer a new path to healing. At Balanced Minds Psych, we believe in empowering people, not just with medication, but with education, support, and the right resources. About Balanced Minds Psych. We are committed to providing accessible, science-backed care in a trauma-informed, compassionate setting. Whether you're considering ketamine, TMS, traditional psychiatric care, or just need a starting point, we're here to help. Affordable cash pricing. Insurance, accepted soon. Helping you save on mental health care. Same-day and evening appointments. Professional, non-judgmental staff. Located in St. George, Utah. 736 S 900E, Suite B107, St. George, Utah, 84790. Call 435-218-7352. Website, Balanced Minds, psychandmbdu.com. Stay connected. Instagram, Facebook, YouTube. YouTube, @TimCox. Balanced Minds Psych. Like this video if you learned something new. Share with someone struggling with their mental health. Subscribe for weekly mental health education, featuring breakthrough treatments like ketamine and TMS. Disclaimer. This video is for educational purposes only. It is not intended to promote or endorse any specific treatment. Always consult a licensed medical or mental health provider before making treatment decisions.